Hi everybody, welcome back to Beauty Buzz with Lori. Today we're going to be talking about lymphatic drainage, and so I have here with me Rosie. She assists Dr. Garcia in the surgery room. What do you like to be called? Surgical tech? Surgical assistant?
Rosie's good.
Seriously, what's your official title?
It's surgical assistant.
Surgical assistant. Mm-hmm. So Rosie, our surgical assistant. Thanks for joining us today.
No problem.
All right, so Rosie, I'm going to be doing one half of her face first, and then we're going to show how that can actually give a little bit of a lift to the face. You can add this on to any facial service. We also use this post-operatively after you've had a platysmoplasty, which is a neck lift. So Rosie also has actually had liposuction. We do use it for that as well. Rosie, talk to us just a little bit about your experience with the liposuction and how the lymphatic drainage massage helped you.
So I had my liposuction done about 2 years ago, and 2 weeks after the liposuction we started the lymphatic massages, which was great because I got rid of most of my swelling within a month of having the lymphatic massages. It's great because once you have surgery, your lymphatic system is interrupted. And so when you start the massaging, you're basically forcing your body to heal faster and to create those channels in which that lymphatic fluid will flow through faster.
Absolutely. Mm-hmm. So your lymphatic system is a very complex system, but it does help with the getting rid of or eliminating waste and toxins as well. It is not pumped by any of the organs or anything. It actually flows in just one direction, whereas like your arteries are pumped by your heart, the blood flowing through there helps to pump that.
So the lymphatic system is actually propelled by movement.
Correct.
So whenever you have surgery, your channels from which the lymphatic fluid runs through, they're interrupted. So when you start massaging, you're forcing that fluid. So let's pretend that you've overslept today. And when you wake up, you go to the mirror, you look extra puffy because you've been lying still for an extra hour than normal. But the moment you get up, you start washing your face, you start walking around your house, making coffee, for example. When you come back to the mirror to do your makeup, you're not as puffy anymore because the movement has propelled that lymphatic fluid.
Right.
So when you have the surgery, those channels, they're severed. They're not working the same way. They have to recreate. And that's something inevitable with any cut, any surgery, any place in your body. It works the same way.
Right. Nothing to worry about.
Correct. Though. It's normal and it's common, but you start doing these massages and you're actually forcing that fluid to create new channels from where to run through faster. So you can either do it the manual way, which we always recommend patients to do at home with their thumbs, or with Lori. That this is
yes,
this is nice.
the low level suction that we use from the hydrofacial machine. So I have already cleansed Miss Rosie, and so now I'm going to put gloves on so I can do her treatment. So if you have questions about lymphatic drainage or how it can help you, feel free to comment below. All right, so if you look at the machine really quick, this has many different functions. Of course, this is the hydrofacial machine that I do hydrofacials with. Over here are the implements that we use in order to do the lymphatic. So this is the little guy right here that we use, this nice little tube here. As you'll see, it has the hole on the side here. And so basically what I'm doing is I'm tapping that hole in order to either drop fluid or pick fluid up with suction. Okay, so we're gonna turn that on. Rosie, if you'll turn to your left for me. Alrighty, so basically I'm gonna start right here just under the ear, and we're gonna pull with suction, drop. Gonna do everything about 3 times. And then we come here in front of the ear. You have lymph nodes all over the body, but the main ones that we're dealing with are behind the ear and in front of the ear. And so what you'll see me doing in a moment is actually pulling everything from the center of the face over to the lymph nodes and dropping it. Okay, just stay just right here. Whenever we're working submentally with the surgery, post-surgery, I'm stumbling all over my words, sorry. But post-surgical, when you've had that, you're lumpy, lots of swelling through here, and we're just going to pick that fluid up and drag it over to the lymph node behind the ear and back down the neck. And so what this is doing is, for Rosie, it's going to give her a nice little lift. If we were doing it post-operatively, it's going to reduce swelling significantly. And it's going to also soften some of those hard spots that they would have post-operatively, which will go away. So typically when I'm doing this, I am doing it 3 passes all together over the face, which is going to give her the lift. And then I'm hoping that that picks up on camera where you can see the right side of her face will be lifted as opposed to the other side, and then we'll even her up. We won't leave you lopsided, Rosie.
Lisa, thank you. This actually feels really, really nice. Very soothing.
So, and when you've had this before, you've talked about how you can literally tell that one side has been done. You can feel it. You can feel that one side's been done and one side hasn't.
Yes.
Talk a little bit about that feeling. What does it feel like?
It's funny, but it actually feels like swelling. Like if I have this side of my face is a little swollen, versus the side that's already been done. This side just feels nice, like a little lift, a little tighter.
And when you're having this done, even post-surgery, it's not a painful procedure. It actually feels good because it's loosening everything up. It's moving that fluid that's making things a little uncomfortable around and getting rid of it. Got one more pass and then we'll be able to take a look.
Yeah, actually, the more patients do the lymphatic massages, the more comfortable they feel. A lot less sore, a lot less tight. They start feeling much more normal.
Yeah, so one of the analogies I use is people who have worked out, you know, your second and third day after you work out, it's harder to move because you're more sore. But if you push through that, it actually feels better and you are able to move without discomfort. So it's very similar to that experience. Okay, so now I'm going to have you turn forward again. And so Heidi's just going to take a shot. You can see that this side of the face looks smaller and more lifted after having the lymphatic, and that's just with 3 passes. So now I'm going to actually even her up, and Heidi can speed up the video so that it's not taking forever. All right, Rosie, turn this way for me. So basically, lymphatic drainage can be used post-operatively to help get rid of swelling, to move that excess fluid, and also to soften the areas where you have those hard, lumpy, congested areas under the skin. All of that is temporary, but we use this to accelerate your recovery, accelerate your healing process, along with the instructed massage that we have you do at home. Those two things are not, they don't cancel each other out. We prefer you to have both. So if you're able, we encourage you to get a full series of 6 of the lymphatic massages. Your first one is complimentary, just in having surgery with us. It's an opportunity for us to explain why you need them and to also show you what it can do to help you. Really you can just get them once a week is what it works out to. So anyway, if you have questions regarding lymphatic drainage, don't hesitate to comment below. If you have other subjects you would like for us to demonstrate or have answers to, also comment below. And thanks for watching. Now she matches on both sides.